discussions with persons who are confused. You want to keep it short and simple, and you want to use cues, both visual and actual cues that you will act out, that the patient can observe. Many times people are not able to understand communication simply because of poor vision, poor eyesight, poor hearing. There may be distractions surrounding them that are taking their attention away from you. You may need to find some way to get them back on cue, back on target with what you're attempting to communicate. When you do establish communication, having reduced every type of distraction and external noise, then you will want to focus very carefully with the patient to make sure that they are understanding you. You're going to have to test to see if they do indeed understand what you're saying. You want to remember once again not to overload the patient. Listen carefully, provide reassurance, don't rush, take your time. It's worth taking your time because the desired result can only be achieved when the patient feels safe and comfortable, and also when they are able to understand as best they can what you're trying to communicate. A couple examples will perhaps help to see the difference between a positive and a negative feedback situation. Many times a person with dementia will wander into someone else's room or some other part of the facility. Our immediate human reaction is, no, that's not your room, don't go in there. And the immediate reaction of most persons with dementia is to become angry, more confused, even combative, and this does not help the situation. The more positive approach to that situation would be to say something like, you know, your own room is so much prettier. Why don't we go and take a look at that? This distracts the patient, puts them in a positive mode, reassures them, and accomplishes your goal, which is to get that patient to leave someone else's room. It's important also when we talk about communication and behavior strategies to use the technique called mirroring or modeling what we want the patient to do. And that is as simple as trying to demonstrate in every way possible what it is that you would like the person to be accomplishing, and to mirror their accomplishments for them as we go along. Always remember when you're approaching a patient to simplify every task and break it down into steps as much as possible. You want to be sure they understand who you are and what you're doing here in their situation. Maintain eye contact. Try to be at their level so they can both see and hear you. Show some humor. Take some time to make a joke. Take some time to make the patient feel reassured. Also, always show respect for the person with dementia. Even though they do have brain impairment, we must always remember that they must be treated with dignity, and they will sense when they are not. Respect their culture, because people from various cultures have various ways to approach tours, most especially in the area of personal grooming or personal care. Here is an example of what you can do in order to break down the tasks. If you're trying to get a patient prepared to get up and get dressed, lay out their clothing for them. You can give them some choices, but not overwhelming numbers. 2 choices on each article of clothing are probably the maximum you'll want, and you want to try to put them out in such an order that they can follow it for themselves. The goal here is to allow the patient to be as independent and self-directed as possible at all times. They feel more successful, and you have less work to do. At mealtime, you can simplify the task for the patient by arranging the place setting and making sure that they can distinguish one food from another and can simply and easily get to their food and enjoy the various items that are presented. Also, in the area of activities, it's important to provide meaningful and fun activities such as music and art therapy for the patients, and it's also important to remember that when you build on music and art therapy and reminiscence therapy, you're approaching the long-term memory, which is often very much intact with these patients. Prayers and songs and pictures from the past evoke good, strong, reassuring memories for these patients. They make activities enjoyable for them, and you will also find that you're enjoying activity time yourself.
Our goal is to maintain independence and to provide and create win-win situations, and they all give us the opportunity to maintain dignity. Since we know that we can't win an argument, and we also know that we have to adapt to the person with dementia's needs, validation therapy allows us to be in their reality because they cannot be in our reality. Here are some key points to understanding validation. Validation accepts people where they are. And of course, we really don't have another alternative. Since they can't be where we are, it is easiest for us to be in their reality. Validation helps them reach their goals, not ours. It is their goals that are important. We're trying to create win-win situations between ourselves as caregivers and the person with dementia. Validation builds self-esteem, it builds dignity and respect. Imagine being told you're wrong, or that's not right, you're doing it wrong, and constantly being corrected. That certainly doesn't do a lot for a person's self-esteem, and nor do you feel very respected. So a way that we can provide respect and provide self-esteem for a person to remain independent is by using validation. And how do we do that? We listen with empathy. We really listen to what someone is saying. We acknowledge their feelings. Sometimes all we need to do is let them talk and let them know that we hear what they're saying. Touch is a very important and very powerful tool that we can use. Sometimes people use this when there is an unwanted behavior, and simply touching or squeezing someone's hand, letting them know that someone is there who cares and that they're not alone will reduce that unwanted behavior. Using who, what, when, where, and how in your questions when talking to a person with dementia will also help. Going to why is really not a good idea because it's very difficult for people to formulate those sentences and explain why something has happened. Reviewing the past, using reminiscence, anything based on long-term memories will be very helpful in using validation. Using song, and dance, poetry, learned prayers from the past is very good in validation. In conclusion, watching your attitude, your tone, and your demeanor is something that we can all do to work out a win-win situation when dealing with persons with dementia. I think Plato had it right when he said, "Good actions give strength to ourselves and inspire good actions in others." And this is particularly true when dealing with persons with dementia. Don't argue because no one's going to win. Actions speak louder than words. Have humor, try not to take offense personally, and remember that it's brain damage. It's not this person communicating this directly to you. Touch and soothing tone is important and very easy to help persons with dementia feel safe. Ask for help because we all have our limits. And remember, you're not alone and your efforts do not go unnoticed. Enjoy being creative and flexible when working with persons with dementia because the rewards far outweigh the challenges.